Hello everyone, this is Dr. Kishore Alapati, consultant colorectal surgeon at Apollo Hospital, Jubilee Hills. Today we'll talk briefly for about 2 minutes on piles, or what we call hemorrhoids. Hemorrhoids or piles are natural blood vessel cushions that all of human beings are born with, and only when there are risk factors then these piles or hemorrhoids will grow in size, and that is when they would cause trouble. So these blood vessel cushions that are there in the anal area are actually there to help us to know when we're passing gas or liquid stool or solid stool, and that would give us the sensation to the brain and saying, hey, you're passing gas through when you're letting it out, or when you're passing liquid stool, or when you're passing solid stool. When patients have chronic constipation or other similar causes, then due to the raised pressure, or what we call an intra-abdominal pressure, these patients would have an increasing pressure to these blood vessels in the perianal area or anal area, and that is when the size of the hemorrhoids would grow in size. The sizes of these hemorrhoids are graded from grade 1 through grade 4, where grade 1s are the ones that are inside the anus, and grade 4s are the hemorrhoids that would come outside the anus and they would constantly stay outside. The most common complaint from a grade 4 hemorrhoid or a grade 3 hemorrhoid is a painless bleeding. So most patients will not experience any kind of pain, even if they're having normal stools without constipation. Due to the increased pressure and or the size of these blood vessels, they would spontaneously bleed, which is what they would see in the toilet as a drop dripping down, or a spurting of blood constantly when they're actually sitting down to pass a bowel movement. A good number of times when patients get to this point of dripping blood or spurting blood from the hemorrhoidal blood vessels, they would almost always require surgery to take care of the bleeding hemorrhoids. When they're in grade 1 or grade 2, medications will be able to take care of it. Lifestyle modifications like dietary modifications and not sitting for too long on the toilet bowl to pass motions, not straining too much, all of these lifestyle modifications play an important role in controlling the size of these hemorrhoids. But when they get to the stage of 3 or a 4, they would most likely require surgical procedure. In the past days, we would do open surgery where we cut the hemorrhoids out and stitch the healthy skin back together. Those days were rather painful for most patients, and almost all patients were out of work for at least a good 3 to 4 weeks until the healing is done. So hemorrhoid surgery was considered as one of the major surgeries because of the amount of pain involved. But these days, with the help of laser ablation or hemorrhoidal artery ligation or stapled hemorrhoidectomy, the surgery has become very minimally invasive. Most patients stay only one overnight in the hospital, and after the surgery is done, within 3 to 5 days, most patients are able to return back to work. So there is nothing wrong in getting a hemorrhoid surgery done. One other most common myth that we have is that, do these piles convert into cancer? Science has proven that the piles would never become cancerous, and they always stay as piles, and the only problem they would cause is bleeding whenever there is constipation. Thanks for listening.